Hi everyone, in this module we'll learn about infant health and COVID-19. Here are a few things to know about COVID-19 infection in newborns. Some newborns have tested positive for COVID-19 shortly after birth. However, most infants had mild or no symptoms, and only a few newborns have had severe COVID-19. To keep your baby safe and healthy during the pandemic, please wear a mask. Stay 6 feet apart, avoid crowds, and get a vaccine. It's important to note that the Center for Disease Control and Prevention does not recommend the use of face shield or mask on your baby. Therefore, do not put a face shield or mask on your baby because this can increase the risk of sudden infant death syndrome. In addition, if you have children younger than 2 years, they should not wear masks. In protecting your baby from having COVID-19, limit visitors to see your new baby. Bringing people who do not live with you into your home can increase the risk of spreading COVID-19. Some people without symptoms can still spread the virus. Limit in-person gatherings and consider other options to see your new baby. When you need to entertain guests, ask your guests to stay 6 feet away from you and your baby. Wear a mask and wash their hands when visiting your home. Finally, avoid crowds and poorly ventilated spaces. Now let's learn about signs and symptoms of COVID-19 infection in babies. The commonly reported signs of COVID-19 among newborns include fever, runny nose, cough, vomiting, diarrhea, poor feeding, shallow breathing, and weakness. If you think your baby may have been exposed to COVID-19, please contact your baby's healthcare provider within 24 hours. And when you observe some COVID-19 emergency warning signs, such as trouble breathing, seek emergency care immediately. Finally, what does research say about COVID-19 vaccines for breastfeeding women? There is no data available on the safety of COVID-19 vaccines in lactating people. There is also no data available on the effects of vaccination on the breastfed infants. And there is no research finding about the effects of COVID-19 vaccine on milk production or excretion. However, what we know from research findings is that COVID-19 vaccines are thought not to be a risk to the breastfeeding infant. Therefore, breastfeeding women may choose to be vaccinated. Thank you for listening.